Hi everybody, this is Cindy Coleman and I am going to be showing you how to do a postpartum assessment on a patient. So before I come into the room, I need to wash my hands. So that's the first part of my wipes. So I'm going to come in, I've washed my hands, and then I'm going to identify my patient. Hello, Mrs. Smith. How are you doing? Geez, I'm so happy. You have a beautiful little baby. How are you feeling? Are you having any discomfort? I'm going to check her wristband to make sure. I'm going to ask her her name and her date of birth. Now, before I do any of this, I'm going to provide privacy, pull the curtains. I'm going to tell her, okay, so what I'm just going to do is got to check your belly out to see where the top of your uterus is, and it might be a little uncomfortable, but not too painful, so let me know if it is. Now, are you having any cramping right now? No? Wonderful. Okay, so when I get done with that, I'm just going to check your perineal pad to see how heavy your flow is. And now I heard you had an episiotomy during delivery, so I do need to check that also. So I'm going to come in, and I have to tell you that because I am below the umbilicus, I personally like gloves. So I'm going to apply my gloves before I do any of this. Okay, so now, when you guys come into practice, we do have various balls that simulate what a fundus would feel like. This one is firm, so you can feel that, and then this one is softer. So you'll be able to tell a firm fundus versus a boggy fundus. So I'm going to put the firm one back in for right now. And you all know you're welcome to play around with these and practice. So, now I am going to check the fundus. I'm going to hold one hand here just to support, right on the symphysis pubis in the umbilicus. Immediately after birth, we're usually at the umbilicus or maybe a little bit above. So this patient actually gave birth 12 hours ago. So I'm going to start with this part of my hand, have this hand here, and I'm just going to press in. And I'm just going to work my hand down until I actually find the ball that just fell out. Okay, we'll try again. Okay, so I'm getting it right here. I can feel it under here. It's a nice firm, just like the top of a tennis ball. So now I'm going to look where my finger placement is, and we measure in what we call finger breadths. So the width of my fingers, and this I'm finding at 2. So it's 2 finger breadths below the umbilicus, or minus 2 FB. So I have checked the fundus. It's firm. Now, when you're checking if it is boggy, if it's soft like this ball, then that means the patient is at risk to hemorrhage. So if it's boggy, you hold your hand here, but you massage the top in circular motions until it firms up. When you're massaging, their vaginal flow is going to be much harder. So keep that in mind. That's what you want. You want to get rid of any clots that maybe have accumulated. So I can feel this fundus right there. It feels nice and firm. Wonderful. Okay, so now Mrs. Smith, I need to check your vaginal flow. So I'm just going to check your perineal pad. Now, I do not have anything on this perineal pad for you to see. But we're going to check, and we're going to look at how much flow is here. We're going to see if there's any odor, any clots. So we're checking the pad for that. Now, you need to ask the patient, when's the last time you changed your pad? You need to see, like I said, if clots, if they're small or large. It wouldn't be unusual to have clots here. So I've checked the peri pad. It looks good. If I needed to help her change it, I would gently wash with soap and water, just like you learned how to wash last semester when you're doing perineal care on a patient. Be very careful. This patient is at high risk for infection. So now I'm going to ask the patient if she will turn onto her side for me, because yes, she had an episiotomy. So now I'm just going to check her perineal area. Now the perineal area is from the bottom of the vagina to the front part of the rectum. Now I'm going to look, does she have any hemorrhoids? She very well could have hemorrhoids from pushing, but I'm going to look at the episiotomy. Now, of course, this patient doesn't, well, she does show right here. See this little slit? That's where her episiotomy is. They never go straight towards the rectum because that puts the patient at higher risk to tear into the rectal muscles. So they always go at an angle, one way or the other. So you're going to look, this patient would have sutures. So you're going to check to see if the sutures are intact. Are there any edges that are torn? Now you also are going to expect this patient to have edema because this whole area has been, it's really been irritated tremendously with a vaginal birth. So you expect edema. You need to look at that. What you don't want to find is ecchymosis that is in the shape of a pea, a tennis ball, because that means we have a small area that's bleeding. So we have to be careful there. But just very gently palpate, see how it is. Don't get near the rectum. Start towards the vagina and work your way back. Once you get to the end, stop. Don't go any further. Okay, so her episiotomy looks wonderful. So I'm going to do that. Just make sure everything is set. Have her turn back over. So then I'm going to talk to the patient and give her some teaching. I want to make sure that she gets up and goes to the bathroom frequently. The urination, if her bladder gets full, then it's going to interfere with the fundus and how firm it is. And I'm going to ask her when she last changed her pad. I am also doing patient teaching on how to clean after she goes to the bathroom. We do not want our patients wiping with toilet tissue. So we provide them with a squirt bottle. And we teach them to warm it up, just fill it up with warm water, and then as they're sitting on the toilet after they have urinated, they're supposed to squirt their area. Start at the front and just squirt really good. If they need another bottle, they could grab another bottle of water. And then toilet tissue and pat dry. That's what we need to teach them. We do not want them rubbing. Okay, Mrs. Smith, you did great. Thank you so much. If you need anything, please let me know. And I'll be back in a little while. Bye.